Good morning or afternoon, everyone, depending on where you're calling in from. Welcome to an online briefing hosted by the Canadian Drug Policy Coalition. So as we begin, I want to remind us all that the people who designed and implemented the first colonial laws related to substance use in Canada did so explicitly and vocally as a means to control and subjugate Indigenous and racialized people. And the ongoing harms wrought by our continued enforcement of those drug policies disproportionately impact Indigenous and racialized people. So this work to change our laws and policies and fight harmful laws to uphold principles of public health, bodily autonomy, human rights, and equity means safer, healthier communities for all of us. My name is Jessica Hannon. I'm the Director of Communications here at the Canadian Drug Policy Coalition, and I will be guiding us through the event today. We have a short time and a lot of ground to cover, so I will do my best to be brief. A few quick housekeeping notes before we begin. If you are attending as media, welcome. We are glad you're here. Please add your outlet at the end of your Zoom display name so that we can make sure that we prioritize media questions during the Q&A. And we will have time for questions in the last 15 minutes or so of this event. To ask a question, please use the Q&A tab at the bottom of your screen, and you can also upvote questions you'd like to hear answered. So in the next 20 minutes or so, we'll hear from members of the Intervenor Coalition. They will speak to what this case is, why the organizations chose to intervene, what will be argued in court, and really what the role of an intervener is. So I'd like to begin by inviting DJ Larkin, who is the Executive Director of the Canadian Drug Policy Coalition, to speak.
Good morning, everyone, and good afternoon. Thank you. I'll quickly overview what the case is about and what the role of an intervener is. So next week at the Superior Court of Justice in Ontario, we will be asked to decide whether Ontario's sweeping restrictions on supervised consumption services, which are a proven life-saving public health intervention, violates charter rights. The decision and the court's reasoning will have implications not only for specific services and people and communities in Ontario who this law would harm, it is also a pivotal moment for how government policy gets made and defended. Will we listen to established evidence and find pathways to end this years-long public health emergency, or will we follow a path of stigma that will see more of us injured and dying? And putting further strain on our healthcare systems that we all rely on. So first, the context of the case. In December, the Ontario government passed a law that will severely curtail harm reduction service delivery in the province. Misleadingly, it's titled the Community Care and Recovery Act. The law introduced location restrictions on supervised consumption services, prohibited municipalities and local health boards from applying for federal exemptions to decriminalize personal drug possession, and restricted them from establishing or supporting supervised consumption services or participating in federally funded prescribed alternative medical programs without approval from Ontario's Minister of Health. As a result, 10 supervised consumption sites across Ontario are being forced to close as of April 2025. A wide range of experts agree that these closures will put people at risk of fatal drug poisoning, brain injury. It will reduce community safety. It also increases stigma towards people who use drugs, and it eliminates proven life-saving services amidst years-long raging public health crisis. So, the neighborhood group Community Services, alongside two individuals who access supervised consumption services, have filed a charter challenge regarding the constitutionality of the legislation. They will argue that the law violates Section 7, rights to life, liberty, and security of the person, due to the denial and restriction of access to services that save lives and reduce the transmission of infectious diseases. Section 15 rights to equality and freedom from discrimination due to the denial of medical treatment for people with substance use disability. And they'll argue that Ontario's law infringes on the federal criminal law, and so it's outside of Ontario's jurisdiction. So here we have today the Canadian Drug Policy Coalition, the Toronto Harm Reduction Alliance, Toronto Overdose Prevention Society, and the Waterloo Region Drug Action Team will be intervening before the Superior Court of Justice in Ontario to advocate for a path that is grounded in public health principles, upholds charter rights, and really protects against the perpetuation of stigma about people who use drugs, and that sends a message that people are not worthy of the care that they need for survival. As interveners, our role is to offer an additional perspective to the court based on the expertise of the organizations in this room. We will offer a public health framework for the court's analysis using 4 key principles: harm prevention, the need for laws to be clear and certain. Policy and law needs to be grounded in evidence, not stigma. And laws need to align between public health and public safety goals. These guiding principles offer a structure and a way for the court to evaluate the validity of the arguments before it, to identify stigma against people who use drugs in both the legislation itself and in the evidence before the court, and also to ensure that that stigma and prejudice is not reinforced in the court's assessment of the claim. So I'll pass it over to other panelists to go through what those principles mean in practice.
Great. Thank you, DJ. I would now like to invite Colin Johnson, co-chair of the Toronto Harm Reduction Alliance, to speak.
Good afternoon, everybody, and good morning. Thank you. Glad to have you here. The Toronto Harm Reduction Alliance is a coalition of people who use drugs, frontline workers, researchers, students, and allies working to improve the health and social outcomes for people who use drugs, eliminating the stigma surrounding drug use, and abolishing the failed war on drugs, which is rooted in racism and colonialism. At their core, supervised consumption sites are about saving lives, preventing harm, a key public health principle. In the face of government inaction or outright attacks on our communities, we keep ourselves safe, step up to save lives, despite social inclusion, criminal surveillance, and persecution. We know this from the AIDS epidemic, also known as GRID, a gay-related immunodeficiency, at the time which killed countless gay young men in the 1980s. In light of government's inaction and apathy towards the LGBTQ community at that time, queers began taking actions to keep each other safe, providing safe sex education, free condoms, and later distributing syringes and injection supplies, cotton swabs, crack pipes, and meth pipes, funded by our own communities. We had to look inward for our own survival and that of our loved ones. Now we are in a toxic drug poisoning epidemic, facing increasing numbers of overdoses and deaths from a contaminated drug supply, and similar indifference from governments. Drug users have opened and operated the first unsanctioned supervised consumption sites in Canada in 1995. It was the work of drug users that led to the opening of the first sanctioned supervised consumption site in Canada, Insight in Vancouver, in 2003. After that, no other supervised consumption sites received federal exemption to open until 2016. In 2017, fed up with the escalating toll from the fentanyl overdoses, people who use drugs and their allies opened a site at Mossbach, Toronto. It was the work and advocacy of people who use drugs that led to the government later opening supervised consumption sites that they're now closing. The Ontario government's decision to close supervised consumption sites, contrary to their own investigations, will lead to an increase in overdoses and deaths across Ontario. Sadly, in Toronto, around 90% of the people who use these sites are unstably housed or homeless, meaning they don't have a place indoors of their own. Taking away services from marginalized communities will certainly cause harm. Without sites available, people will instead use what is readily available. Public spaces such as alleyways, parks. People use public washrooms in libraries, businesses, and community centers. These locations are not hygienic and will increase the bacteriological risk of infections and abscesses. It's important to remember that permanent brain damage will occur 4 minutes after someone stops breathing, and it only takes 4 additional moments before someone dies. The lack of timely intervention will certainly cause harm. People who won't have access to new equipment, which will certainly lead to the sharing of drug supplies and increase the possibilities of HIV and Hep C transmission. In these locations, unlike in a supervised consumption site, there are no opportunities for the person to also get connected to other services, wound care, housing, mental health supports, and treatment. Supervised consumption sites provide a multitude of benefits to people who use drugs and the broader community. Their closure will without doubt cause unnecessary and preventable harm to some of the most marginalized communities in our people in our communities. Thank you.
Thank you so much, Colin. And I would now like to turn it over to Zoe Dodd from the Toronto Overdose Prevention Society.
Thank you. Thanks, Colin. Thanks, everyone, for being here. I know this is particularly tough for many of us. My name's Zoe Dodd, and I'm a co-organizer with the Toronto Overdose Prevention Society. We're a group of people who use drugs, researchers, healthcare providers, advocates, friends, allies, who formed in 2017 to address the inaction by all levels of government in addressing the toxic drug death crisis. As Colin said, we're a group of people who demonstrated how easy it is to set up an overdose prevention site and start saving lives. We are people who know intimately the grief and loss of losing someone, or many from a preventable death. We are intervening in this case because we firmly believe that supervised consumption services save lives, that the sites are a lifeline for people, and that their removal will cause more needless deaths. Staff working at SCSs across Canada reversed more than 58,444 overdoses between January 2017 and May 2024. It has been 7 years since the Ford government took office, and in that time, this government canceled the Provincial Overdose Emergency Task Force, has no system-level coordination to address this crisis, and has shown that they don't care about the scientific evidence or the lives of people who use these sites who are at risk of dying. From 2016 to 2023, the number of opioid-related deaths in Ontario increased by 205%. According to Ontario's own Auditor General report released in December, the Ford government does not have effective processes in place to deal with the ever-increasing crisis. They have relied on a strategy from 2016 created by then the Liberal government that was focused on prescription opioids, not the unregulated toxic drug supply. This government has demonstrated that they are more concerned with fueling stigma and discrimination than with addressing these very serious issues. And so I want to talk about death because that is something this government is choosing not to talk about. They have repeatedly stated since August when they made the announcement and defunded the selected sites that no one will die. And they have been purposefully, misleading people to believe that we are not in a toxic drug death crisis. Not only will they close half the sites in Toronto, they are also closing the only sites in several cities, including Hamilton, Kitchener, Guelph, and in Thunder Bay. They wouldn't fund two amazing local sites in Timmins and Sudbury that were doing great and saving lives, and those sites had to close last year. By forcing the site in Thunder Bay to close, they are closing the last site in the northern part of this province where the death rate from overdose is double the rate in the southern part. Sites have already closed in Peel Region and Ottawa, where increases in public use and overdoses has now increased. The South Riverdale Community Health Center site closes their doors tomorrow. This is a travesty born of stigma and discrimination. It has been almost 10 years since I sat personally in a funeral home with over 200 other people to mourn the loss of our friend, a musician in this city. As we sat in the funeral, his father told us in detail how he found his son dead and tried to resuscitate his lifeless body. Everyone in the room was crying. He could not save his son who had unknowingly used heroin laced with fentanyl. His family not only lives with the loss of their child, but also the trauma of finding him dead. There are 50,000 families across this country who have lost a loved one or loved ones from a preventable death. They are grieving, and this type of grief I would not wish on anyone. The government has brought forward affidavits from people who are uncomfortable with having to witness other people suffering. Sure, it's not easy to witness the suffering that comes with gentrification, homelessness, extreme poverty, and trying to cope with past traumas. And yet, I want to remind this handful of people that it is far worse to have to actually live it. And so it's important for us to locate the real problem. A supervised consumption site cannot end poverty. It cannot change the toxic drug supply. It cannot end homelessness. Sites are located where there is need and where there are high rates of overdoses and overdose deaths. Sites are often located in health centers to make it easy to connect people to healthcare and other social supports. And research has shown that neighborhoods with sites have been had a significant reduction in overdose deaths. And they have made over 450,000 referrals and saved so many lives by being there when people need them most. People who access supervised consumption sites are parents, grandparents, somebody's child. There are people who are struggling with poverty, homelessness, racism, homophobia, transphobia. They are childhood sexual abuse survivors, the children of residential school survivors, 60 Scoop survivors, survivors of sexual violence, survivors of institutional violence. They are human beings who are deserving of life. They are deserving of care, and they deserve to be here. And they deserve to be able to continue to access evidence-based services like supervised consumption sites, because these sites have not only kept so many people alive, they have also been the places where people find care and community. I have been honored to know women who use supervised consumption services in Toronto. That connection and care supported them on their journeys of reconnecting with their children, changing their lives. Two women I know are currently getting college diplomas. Well, only a couple years ago, they were regularly using supervised consumption sites for their survival. They are raising their kids and they are still here. I think of their families and their kids. Their kids have mothers caring for them today because these sites were there to allow them to use safely and help connect them to services that help them find stability in their lives. I think of these families a lot. I think of my best friend who helped to raise her niece after her brother died of an accidental overdose. My dear friend and colleague who still feels the death of her young, beautiful son deep in her chest. I think of my colleague who is raising her siblings' children. I think about how loss brings more loss and death brings more death, and how preventing deaths is a very worthy venture. The lives of people who use sites are not disposable. People who use drugs deserve care, and they deserve to have access to life-saving services. This act will kill people, and the government knows this. Thank you.
Thank you, Zoe. And I just want to take a moment to let all of us, especially you, Zoe, absorb all of these beautiful little hearts that are popping up and see some of the comments that are coming through in the chat. Yeah, I really appreciate you, and I really appreciate you bringing it to the level that we all know that it matters at, which is people and the people that we love, and too many people that we love that we have lost because of government failures and government action. So thank you, and thank you everyone for the support that you're sharing for Zoe. Take a breath after that. I would now like to invite Michael Parkinson from the Waterloo Region Drug Action Team to speak.
Thank you, Jessica and Zoe and Colin and DJ and all those across Ontario and beyond who continue to advocate for life-saving services in the face of like so little action from governments at all levels. It'll be 12 years ago in June that I wrote what might have been one of the first advisories warning of the bootleg fentanyls appearing in the drug supply in Canada. I am Michael Parkinson. I'm a volunteer with the here in Kitchener with the Waterloo Region Drug Action Team. We are unfunded, we are nonpartisan, and we are honest. Waterloo Region has a long history of working together to improve community health and safety. So our members have lots to say when serious issues such as crime and victimizations are, without evidence, weaponized to provoke fear, promote stereotypes, and divide communities, to justify decisions that harm, not help, community health, safety, and well-being. We know everyone is better off with our single CTS site intact than without it, right where it is, downtown, across from the daycare and City Hall, up the street from 2 schools bordering a beautiful neighborhood. We do not recognize the language and rationale manufactured by the Ontario government to justify eliminating CTS sites, restrict drug checking services, while imposing outrageous prohibitions on municipalities seeking to serve and protect the constituents who elected them. The CCRA will not bring the relief we all seek, whether we are consuming unregulated drugs or not. And we remain big fans of the Canadian Charter of Rights and Freedoms, even when a minority of elected officials and foreign interests are not. When the health minister says people are not going to die, they are going to get access to service, we know this is untrue. We know people are going to die, followed by access to coroner services. During the pandemic, a consumption service was established locally at a temporary shelter. Injection on the inside, inhalation on the outside. Nobody died. After that shelter closed, at least 3 residents were dead before Christmas. The CCRA does give the minister the power to approve future consumption services, but this minister was clear at the CCRA's launch. Quote, "There will be no further safe injection sites in the province of Ontario under our government." The Waterloo Region Drug Action Team shares the concerns provided by internal staff and counsel to the Ontario government in advance of drafting the CCRA. We concur with the Toronto Board of Health. The impacts are predictable and severe. We agree these impacts will not be evenly distributed across our community. We are mortified by the provincial distaste for life, liberty, and the security of constituents. We are puzzled by statements from our premier that CTS sites are, quote, "the worst thing that could ever happen to the community," that they are, quote, "leading to serious safety problems for childcare facilities and schools." This is not the experience in Kitchener and elsewhere, where, for example, many crimes of interest to neighborhoods have declined in areas with a CTS and increased in areas without a CTS. There is overwhelming support here to keep the CTS operating right where it is, from the childcare facility across the street to members of neighboring schools and churches, from area neighborhoods and the CTS Neighborhood Advisory Committee to the Kitchener Downtown Advisory Committee, from the municipal to the Council of the Regional Municipality of Waterloo, from CTS clients to faith leaders to professionals in health, medicine, and those providing direct service to the thousands of people consuming unregulated drugs across Waterloo Region, including students from our 3 post-secondary institutions. To have the government dismiss the collective wisdom of our community all the way into a courtroom is the real threat to our public health and safety. We are puzzled by a government that will depend on American witnesses and some random observations from 21 private investigators hired to spy on citizens in January over the bounty of made in Ontario evidence and wisdom. Waterloo Region rejects the fact-free, radical legislation that shuts down CTS sites whether they exist inside or outside a 200-meter buffer during what is, by any metric, a raging and unprecedented public health emergency. May justice prevail.
Thank you, Michael. And lastly, I would like to pass it back to DJ Larkin to speak again about one final element of the intervention.
Hi, thanks. Sorry, you get me twice, folks. I just want to come back for a minute to just wrap what you've all heard up into why this intervention from these groups matters. You've heard about how communities have acted for decades to save ourselves and our loved ones. You've heard how stigma is literally killing people. You've heard how even the government's own data demonstrates that people will be harmed. So this intervention from our coalition is about a public health approach to legislation. It's about why this is essential to get out of a years-long public health crisis that is claiming lives and impacting the well-being of hundreds of thousands of people across the country. When we bring this forward to court, central to that public health framework is that we need to assess a law which government says is designed to increase public safety. So we need to assess that law to determine, does it actually undermine both public health and safety? If the application of the law worsens public safety risks that it was created arguably to address, or it causes harm to critical public health services, that law is not justifiable. So if the CCRA was enacted due to public safety concerns about drug use outside supervised consumption sites, and it will force the closure of sites, that means options for people to use drugs indoors is decreased. So the act ultimately leads to more public drug use. The effect of the law worsens the issue that even the government says it wants to address. We also know that a lack of harm reduction services and supervised consumption sites will result in poor health outcomes, and you've heard it here today. We can anticipate increased rates of death, brain injury, and transmission of things like HIV and Hep C. So if this law increases public health risks, it is not creating the conditions of safety for the benefit of entire communities. That law is not justifiable. And public safety and public health go together, and they have to be understood in the context of broader system failures. As you've heard from the panel, many of the facts the province is alleging are the result. So the province is alleging certain facts are the result of the existence of supervised consumption sites, but really they're the result of government failures. So if the concern is people being in public spaces, being sedated, or inhaling drugs outside of a site, those are the predictable result of ongoing failures to invest in housing solutions, failures to resource sites to provide a spectrum of services, including inhalation, and failure to invest in effective voluntary treatment services. And those treatment services, as of recent data, have wait times nearly a year long. So permitting a government to enforce a law that punishes people for their government failures is layering harm upon harm. It does not provide the solutions that communities need. True public safety includes the positive presence of things that actually keep us safe. It's access to timely care, connections to loved ones, a thriving community where we are all accepted, spaces to gather, access to shelter, access to hygiene facilities. All of these can be provided, and when appropriate resources are invested into supports and services, including supervised consumption sites. These services bridge the gap that is created by systemic failures of our governments to adequately meet the most basic needs of people. So we see the compounding effect of a housing crisis and a toxic drug crisis. That should not lead to the closure of life-saving services. It should lead to these services being scaled up. So this coalition hopes that the court will use this framework to understand the benefits of public health first measures, the importance of grounding legislation in evidence, not fear. And this recognition is especially important right now, given that there is a recent push by some politicians to return to a criminal law-centric approach to a public health crisis, to rely on misinformation, and to take policy pathways even where there is no evidence of the benefit of a criminal law approach from either a public health or a public safety perspective. We're asking the court to follow the evidence and save lives.
Thank you, DJ. So we now have a bit of time for questions. We are going to prioritize media questions, and you can use the Q&A tab at the bottom of your screen to submit a question or to upvote questions. And as I'm just taking a look at the questions, I just briefly want to call attention to the reality that there are more than 300 people who have joined us live today at noon on a Thursday on a few days' notice. So that is really heartening to see, and I am very appreciative of all of you for being here. So let's see. I mean, might just start with a brief process question. When do you expect to hear a decision? What will kind of the process look like after the hearing is next week, March 24th and 25th? What happens after that? And maybe that's a good DJ question.
Okay, I can take that one. So the court will require time to consider a huge amount of evidence. It's thousands of pages, and 2 days of argument. The applicants are seeking an injunction. So what they're asking for is for the court to make an order really quickly to put this law on hold, essentially putting in place an interim injunction saying the law should not come into effect so that these closures don't have to occur as of April 1st. In order to give the court more time to render its full decision. So if they're successful, that means there could be a court order in a matter of days, putting the law on hold, and then it could be a matter of months after that. Well, the judge makes a decision on the evidence about whether this law should exist at all, or whether it should be struck down because it breaches constitutional rights.
Great, thank you. So I have a question from John from CBC Kitchener-Waterloo. The coalition said the first principle of the challenge is harm reduction. The Ontario government's approach is abstinence-based. Last December, Ontario Premier Doug Ford was quoted as saying, "You can't feed people drugs and expect everything is going to turn around." What do you think that says about the province's understanding of the drug situation? And I will leave this to whomever might want to jump in on that, a response to that quote and the Ontario government's understanding of the drug situation.
So if I may, thanks. So to be honest with you, first of all, abstinence is part of harm reduction. Let's understand that. And I think that's a challenge that many people have, understanding that they think that they're in opposition. They're not. For many people, abstinence is the only route to harm reduction, whereas harm reduction itself is a series of items and methodologies that people use. It could include treatment. It could include going to meetings. It could include taking medications. There's so many parts of it, but just the basics of being able to get safe supplies, new syringes, going and getting wound care, all of these things combine to make harm reduction. And harm reduction is constantly evolving and has evolved, as I tried to explain, from the AIDS epidemic to what we have now. Safer supply is considered to be part of harm reduction. So it's constantly changing, and it has to change to meet the changing needs and how the changing drug supply that we are facing. To put it boldly and basically, the province's concept of what harm reduction is incorrect and is outdated, as far as I can say. And I think many people who deal with this would agree with me. And I'm just going to leave it for everybody else to answer, but I just want to make that just plain. Thank you.
Yeah, I just want to be clear that the government made this announcement on the same days that they decided to expand access to alcohol in corner stores and in gas stations in the province of Ontario. And when we're talking about like feeding drugs to people, alcohol is also a drug. It's widely accessible, it's regulated, but that regulation means that it's controlled, and it means that people don't die of a toxic drug, like what is happening here with people who are using opiates. And the toxic drugs keep changing. They're ever changing. Now we have xylazine and nitazines. We're having people have cardiac issues when they're overdosing. Like, it has become even more toxic, more uncontrolled, more rampant. The government has made a choice to let people die because they are married to eugenicist and supremacist ideologies, which we don't talk enough about in this country, but it is in their benefit to see people die. And then the treatment system itself has not expanded to actually support people. The government created a roadmap to wellness in 2020. It has no markers, it has no quality improvement, it has no coordination. We heard Thibodeau recently in an interview talk about withdrawal management services. Withdrawal management services are pretty archaic. We're talking about people withdrawing from drugs that are so toxic, so mixed that it's not straightforward anymore. We're not talking about heroin or Oxycontin going to methadone. We're talking about people who have become dependent on nitazene, xylazine, benzodiazepines. We're talking about people who we tried with safer supply programs to support, which are also closing at the end of this month. This is a chaotic situation. And when you have people not at the table talking about all of these aspects of a system and how it needs to change, one Auditor General's report after another from 2019 to last year, to the Medical Officer of Health of Ontario saying, you know, we need to do this. We are not the problem. Harm reduction is not the problem. We have been the most vocal about the system. We are people who do not make money from the system. We are not people who benefit from a business model like you do in the drug treatment system, which is privatized in this country. We are people who just want to save each other's lives. We are people who care about other people. We care about pragmatic approaches. We care about evidence. We care about people surviving and thriving. We can't do anything about the toxic drugs because that is part of the laws. That's about prohibition, and that's only getting worse. So for me, it's, you know, what the government is saying is just a very unserious. They don't take this issue seriously. When they first took power, they stopped the provincial overdose task force. They stopped meeting and convening people from around the province who are experts, doctors, researchers, pharmacists, pain specialists, you name it. They were there at a table and they cut that. That showed right away that they were extremely unserious, and they've continued to be since day one.
Thank you, Zoe. I have a question from Sarah from CBC Toronto. Sarah's question is, could you elaborate on how presenting the public health framework for consumption sites supports the applicant's argument that the province's legislation violates sections of the charter? DJ, I wonder if that is one for your lawyer brain.
So, I mean, as an intervener, we're not here to specifically say we support one side or the other. We're here to say this is what the evidence is, and this is how the law should be interpreted, regardless of what any party says. So we're here to follow the evidence. And providing a public health framework allows the court to look at what is frankly like a tit for tat evidence record, where some, government says some people complain about this, and then, there's evidence, and then there's considerable evidence on the other side about the benefits of these sites. And so public health framework allows the court to really get in there and say what actually matters here. What is the harm that we actually need to be most concerned about? Because it is about people dying. It is about people being harmed. It is about not letting government get away with putting a law on top of failure after failure to provide treatment services, to provide housing, to provide the resources that people need. And so rather than the court trying to swim through all of this evidence without some guidance, we want the court to have the guidance that says the job has to be to assess what is the real and most important harm that we have to prevent. How do we not get fooled by stigma and fear? And how do we make sure that government doesn't get to impose a law that is harmful in order to try to hide people and harm people who are already suffering from failures of government around housing, around healthcare, around treatment services, and around like basic essentials of life and dignity? So that's essentially what the guidance we're trying to provide the court to help them in their decision making.
Thank you, DJ. This is, I'm sorry to put you on the spot, but probably another one for you. This is from Dustin Godfrey. So Dustin asks, can you share any precedents you'll be leaning on in your arguments and any brief analysis for how they apply? I will also note for media, if we don't get to your question, because we have about 3 minutes left, then you have my contact information and we can arrange one-on-one interviews. But DJ, I'll pass it to you on precedents you'll be leaning on and any brief analysis.
I'll be really quick. I mean, what you've heard from the panel today is the core of it, but probably the fastest way to address that is we can send out our factum where you can see how we've outlined the principles and taken examples from the record of evidence to help demonstrate the principles as they apply. So perhaps we can send that out to folks after.
Great, thank you. So this one is from the Toronto Star. David asks, what are you seeing on the ground now in terms of drug toxicity and deaths? stats show drops in some jurisdictions. So I wonder if that Zoe or Colin or Michael would be able to speak to that one.
I mean, first of all, I just want to say that prior to 2016, we did not have thousands of deaths in the province of Ontario. So when they say drops, we're not going back to pre-pandemic levels or pre-2016 levels. They're talking about a certain number. I mean, drug users are not so many people have died, so it just continues. I just will say that in the last few weeks, a number of people I know have passed away, including a coworker who was found in his home. And so when we're talking about this, we're talking about real people. Like these are not numbers or statistics, but like people are overdosing and dying. Even with the announcement, people stopped using the services they used for their lifeline. And just to be clear, I know there's one other question about funding. The government defunded these in August. They gave organizations a letter that said that they were being defunded before the legislation even passed. The legislation was passed undemocratically with 1 hour of debate and no public could not intervene or comment. It was, and so just to like put it out there, like we already know the impacts. People are already like seeing people overdose elsewhere and trying to respond, and that we know that in places that they've already closed, that they've had to ramp up paramedics and outreach workers to respond to people outside. Now, leaving people outside means that people are more susceptible to brain injury and acquired brain injuries and death. And we know what it was like when the works closed during COVID in the first lockdown of the pandemic. We were outside trying to save people's lives, and people found other people dead on sidewalks. The reality of that is real.
Thank you, Zoe. So I know that we have more questions we weren't able to get to. I appreciate all the questions. Please feel free to reach out directly if you are media and we didn't answer your question. I saw, Dustin, your follow-up, for instance. The question I want to end on is we've had lots of questions of folks wondering how they can follow the hearing, how they can support, what kind of actions can people take to support the organizations that are here today and the organizations that are offering that support to folks, people who use drugs in Toronto and in Ontario who are going to be affected by this. So if there are ways that you would like to share that people can help, I think we have about 300 people who are very keen to hear that.
You can follow Hack Toronto. You can follow the Toronto Overdose Prevention Society. You can follow WR Drug Action. You can follow Toronto Harm Reduction Alliance. We're all online. We're all on, some of us are still on X. We have Instagrams. You could come to the courthouse on the day of. There will be a rally at lunch hour that will be happening on the day to show solidarity. There will be a web link, which we're still waiting for from the judge, that people can follow online. If you're someone with money and you want to donate to organizations after the injunction, after we get the injunction, that would be amazing, because we had 2 sites close in 2018 that the government closed, Street Health and TNG, who are the ones who are bringing this forward, and they have been running on donations ever since. And so if you have money, if you have access to money, we need your money. And I'm blunt about that. Like, it's unfortunate that's how we have to serve things, but that's how things are going. We have to fight for the funding. We have to fight together. We need to unite in solidarity. We cannot let this just be over. I know we're exhausted. Many of us, we're tired. We have been at this for a very, very, very long time, but we have to work in solidarity to honor the people we've lost, and we need to speak up. If you're a person who has lost someone, if you've been trying to access the system, if your family member tried, we still need to fight. We still need you. We need our solidarity, and we need to get our voices out.
Thank you,
And the
Zoe.
HIV/AIDS Legal Network has put in links of like where you can look at the factums. Those are all public record, so you can see what the government picked and chose. But they did not speak to the evidence that was put towards them, nor did they ever talk once about the deaths that have happened in this province and their responsibility. It's shameful.
Absolutely. Thank you, Zoe. And we will be sending out a recording of this event after to everyone who registered, and we will also include some of the links to those details, the factums, the links to where you can find out more. So we will be following up later today or tomorrow with that. So I am going to regretfully wrap things up. I know there's a much longer conversation that we could have, but I just really want to express my gratitude to all the panelists today. Thank you for sharing, and thank you for all your work. As Zoe said, I know a lot of folks have been doing this work for years and years and lost far too many loved ones. And we're really appreciative that you continue to do this work. Thank you everyone for coming. Look out for the links in the recording in your inbox, and please do share this as widely as you can. And the hearing will be next week on March or 23rd, 24th, 25th. All right. Thank you everyone. Take care.